This is a quick review of respiratory medications. If two medications are prescribed, administer the bronchodilator first and the corticosteroid second. Bronchodilator should be used with caution in patients with hypertension, diabetes mellitus, and narrow-angle glaucoma. Theophylline increases the risk of digitoxicity, decreases the effects of lithium and phenytoin. If theophylline and beta blockers are administered together, cardiac dysrhythmias may result. Beta blockers, cimetidine, and erythromycin increase the effects of theophylline. Barbiturates, carbamazepine decrease the effectiveness of theophylline. Side effects are palpitations, tachycardia, hyperglycemia, and decreased clotting time. Monitor the therapeutic serum theophylline level of 10 to 20 micrograms per ml. Intravenous administered theophylline preparations should be administered slowly using the infusion pump. Anticholinergics are inhaled medications that improve lung function. They are effective for treating COPD, allergy-induced asthma, and exercise-induced bronchospasms. The side effects are dry mouth and irritation of the pharynx. Glucocorticoids, also known as corticosteroids, are anti-inflammatory agents that reduce airway edema. Leukotriene modifiers are used in prophylaxis and treatment of chronic bronchial asthma. It is not used for an acute asthmatic episodes. Side effects are headache, nausea and vomiting, dyspepsia, diarrhea, generalized pain, fever, and dizziness. Interventions are to assess the lung sounds for rhonchi, wheezing, and assess liver function studies as ordered. Instruct the patient to take the medication 1 hour before or 2 hours after meals, and instruct them not to discontinue the medication unless they are told to by the physician. Monoclonal antibodies are immunoglobulins that can be synthesized to have a single specificity for therapeutic regimens. The side effect is immunosuppression. The intervention is to instruct the patient to avoid others with infectious disorders, and that they need to eat a well-balanced diet, get plenty of rest, and sleep. Antihistamines like diphenhydramine has an anticholinergic effect that should be avoided by patients with narrow-angle glaucoma. The side effect is drowsiness, urinary retention, blurred vision, wheezing, constipation, dry mouth, GI irritation, hypotension, photosensitivity, and nervousness. The interventions are to instruct the patient to avoid hazardous activities, alcohol, and CNS depressants. Nasal decongestants stimulate alpha-adrenergic receptors, producing vasoconstriction of the capillaries in the nasal mucosa. It is used with extreme caution in patients with hypertension, cardiac disease, hyperthyroidism, and diabetes mellitus. The side effect is that it can cause tolerance and rebound nasal congestion. The intervention: monitor for cardiac dysrhythmias and blood glucose levels, and instruct the patient regarding the importance of limiting the use of nasal sprays. Expectorants and mucolytic agents. Expectorants loosen bronchial secretions and are eliminated with coughing. The mucolytics thin out bronchial mucus. The side effect: GI irritation, rash, and oropharyngeal irritation. Intervention is to instruct the patient to take medications with a full glass of water, maintain adequate fluid intake, and encourage the patient to cough and breathe deeply. Acetylcysteine should not be mixed with other medication if given via nebulizer. Antitussives act on the cough center in the medulla to suppress the cough reflex. The side effects are constipation and respiratory depression. Intervention: instruct the patient if the cough lasts longer than a week that they need to notify the healthcare provider. Encourage the patient to maintain adequate fluid intake and to sleep with the head of the bed elevated. Opioid Antagonist reverses respiratory depression in opioid overdose. The side effect is CNS depression, nausea and vomiting, tremors, diaphoresis, hypertension, and tachycardia. The intervention is to assess the vital signs, especially the respirations, have oxygen and resuscitation equipment available during administration. Isoiazide is used with caution in patients with chronic liver disease, alcoholism, renal impairment, or taking hepatotoxic medications. It may decrease ketoconazole concentration. Monitor the liver function test results and signs of hepatitis. Monitor for tingling, numbness, burning extremities, and visual changes. Also, the nurse should monitor the complete blood count and blood glucose level. The medication is administered 1 hour before or 2 hours after a meal. It should be given at least 1 hour before antacids. The patient should be instructed to not skip doses, to take medication for the full length of the prescribed therapy, and instruct the patient to avoid tyramine-containing foods like chocolate, alcohol, and fermented food. Rifampin. Side effects include vision changes, hepatotoxicity, hepatitis, increased urinacic levels, blood dyscrasias, and colitis. Evaluate the CBC, uric acid, and liver functions test results. The patient should be instructed to not skip doses and take the full length of the prescribed therapy. The patient should be advised to avoid taking the medication with antacids and instruct the patient to report signs of jaundice to the healthcare provider. Ethambutol. This is used with caution in patients with renal dysfunction, gout, ocular defects, retinopathy, and cataracts. Side effects include hypersensitivity reaction, dermatitis, optic neuritis, and peripheral neuritis. Determine the baseline visual acuity and color discrimination. Monitor for visual changes, uric acid concentrations, assessing for painful swollen joints, intake and output, renal function, and dizziness, and be sure to initiate safety precautions. Educate the patient to not skip doses and to take medication for the full length of the prescribed therapy. Pyrazinamide is used with at least one other antitubercular medication. The side effects include increased liver function, uric acid levels, photosensitivity, and hepatotoxicity. Evaluate the CBC, liver function test results, and uric acid levels, and observe for hepatotoxic effects. Evaluate the blood glucose levels and instruct the patient to take the medication with food and to avoid sunlight and ultraviolet light. Rifampin is used to prevent and treat disseminated Mycobacterium avium complex and tuberculosis in patients with advanced HIV infection. It can affect blood levels of some medication. The side effects are rash, GI disturbances, uveitis, arthralgia, and hepatitis. Observe for hepatotoxic effects and assess for swollen or painful joints and ocular pain or blurred vision. Rifampin is used only for pulmonary tuberculosis. The side effects are red-orange body secretions, hepatotoxicity, and observe for hepatotoxic effects. Capreomycin do not administer to patients receiving streptomycin. Side effects are nephrotoxicity, ototoxicity, and neuromuscular blockades, as this is increased with the use of aminoglycosides or loop diuretics. Assess the renal, hepatic, and electrolyte levels before administration. Antibiotics, kanamycin and amikacin, are contraindicated in patients with hypersensitivity, neuromuscular disorders, and eighth cranial nerve damage. There's a risk of toxicity increases when taken with other aminoglycosides, nephrotoxic, and ototoxic drugs. Monitor for liver and renal functions tests and assess hydration status. Educate the patient to notify the healthcare provider if hearing loss, changes in vision, or urinary problems occur. Ethionamide is used with caution in patients with diabetes mellitus or renal dysfunction. The side effects are metallic taste, jaundice, and peripheral neuritis. Monitor glucose levels in patients with diabetes mellitus. Administer pyridoxine as prescribed to reduce the risk of neurotoxicity. P-aminosalicylic acid is contraindicated with hypersensitivity to salicylates and compounds containing para-aminophenol group. Assess for hypersensitivity and encourage fluid intake. Cycloserine side effects include CNS reactions, neurotoxicity, and altered level of consciousness. Monitor for changes in mental status, thought processes, serum drug level, which should peak 2 hours after dosing. Advise the patient of the need for weekly serum drug levels and to teach the patient about signs indicating adverse effects. Streptomycin is contraindicated in patients with hypersensitivity, myasthenia gravis, Parkinsonianism, and eighth cranial nerve damage. Monitor liver and renal functions tests, ototoxicity, and nephrotoxic reactions. Assessing hydration status is important to maintain hydration during therapy.